So let me talk about this question. The question is here, what would be an appropriate nursing intervention at the birth of a neonate anencephaly or encephaly? So if any baby born with the congenital defect like anencephaly, what would be our first priority? So anencephaly is the absence of a major portion of the brain or skull and also the scalp. So baby born without brain tissue. That occurs during the embryogenic development. It is the cephalic defect that result from a neural tube defect that occur when the at the end of the neural tube failed to close. So most of you already know what is neural tube defect, but it is also like this. But that one affect the brain, and absence of the major portion of the brain, skull, or scalp. The baby who born with this problem, most of them die inside the uterus during the last trimester of pregnancies. We call stillbirth. If any baby is survived, they will not celebrate their first birthday even. So they will die just after their birth. So in that scenario, there are 4 options as a RN or LPN, what I have to do first. Number 1, they said, discuss the need for physical therapy with the parents. So this baby will not survive longer. So why talking about the physical therapy? They do not need it. Then provide the comfort care of the neonate. So definitely it is the good choice. But let me explain number 3 and 4 first. Provide the genetic counseling for the parents. So genetic counseling is important for the next pregnancy, because no parents want their baby born with congenital defect. So when you go to the counseling, they can identify mother is under risk or not, right? But this baby already born, it is not necessary for this baby. So number 3 is not a good choice. Refer to the parents to the supporting group for the children with anomaly. So we said baby will die within a time or after the delivery. So it is not necessary supporting group. Yes, maybe need to supporting group to mother to coping mechanism or for future pregnancies, but not this baby. Number 2, they said provide comfort care. So if this baby born with anencephaly, it is good to give them comfort death, right? So if they need oxygen, you give them oxygen. If they are heat loss, give them some extra cloth, protect the heat. So this is the good choice, provide the comfort care for the neonate, like clean the respiratory system, give them oxygen, and facilitate their departure. So what is their explanation? They said anencephaly is a neural tube defect that result very little to no brain tissue forming in the uterus or utero. The majority of fetus with anencephaly will be stillborn, means they die during the last trimester of pregnancy inside the uterus. Those born alive will not survive for long. So then, if you know they will not survive, so better to give them little bit comfort. So what does mean comfort? Means give them supportive treatment like oxygen. So comfort should be provided for neonate, like um, bounding, dying, or placing the neonate skin to skin with mother for heat or warm or possible administration of oxygen to neonate will decrease the discomfort of impending death. Also, allowing the mother to hold the neonate will assist to grieving process. So it is very important. And what are the education objectives? Neonate with anencephaly is typically stillborn. If neonate is born alive, death usually occurs shortly after birth. Comfort care for neonate, including warm or give oxygen, should be provided to decrease the discomfort of impending death. So question here, the nurse is teaching the parents how to care for a newly circumcised newborn. Which statement by the parents indicate that further teaching is needed? So there are 4 options about the circumcised newborn. So out of 4, which one is wrong? I need to correct. I need to teaching my patient. So which one is the correct? This should be the answer. And my patient is circumcised, right? And circumcision is the surgical remove of the foreskin, and that tissue covered the head of the glans penis. Definitely, it is very old practice that has its own origin in religious purpose. So many parents have their son circumcised for religious or other reason, right? So if the son or newborn circumcised, then what we should do? Discharge and order indicate infection of the circumcised site. So if any infection is occur, definitely the discharge will be normal. And also bad odor, offensive odor, it indicates infection. So if patients say it like this, yes, parents are correct, nothing wrong. Number 2, I will clean the area with the alcohol-based and or soap water. So you can clean the area with a clean, pure water. You do not need any soap or alcohol-based solution. It is wrong because alcohol delay the healing of the area. And also soap is a alkali, better not to use. Just use the clean water. So this is wrong. You have to re-educate them, reinforce them. Number 3, infant crying during the petroleum gauze change. Definitely it is expected, nothing abnormal. Number 4, diaper should be changed at least every 4 hours. Number 4 is correct. If diaper is not dirty, still you have to change at least every 4 hours. If diaper is gets soiled, you can change early. Nothing abnormal. So what is their explanation about circumcision? They said the common complication of circumcision include excess bleeding like hemorrhage or infection. If patient have infection, their body temperature will be go up. Any secretion pus will be discharged or offensive or water will be out. Also avoiding avoiding will be difficulties. Painful voiding means menstruation will be painful. The parent should clean the area with a warm water. Do not need soap, do not need any alcohol, right? So we clean it to prevent the infection, But alcohol-based solution delay the healing and cause discomfort. And this should be avoided until circumcision site has healed up. Usually it takes 1 week. 1 week. Usually takes 5 to 6 days. So what are the educational objectives? In recently circumcised newborn, parents should be educated to use only warm water for cleaning and avoid the soap water or alcohol-based solution. After 24 hours, a yellow exudate forms as a part of the normal healing process. So you do not need to remove it. And pain is expected, and parents can provide additional comfort measure after the diaper change to minimize the discomfort. So something about important for diaper change for neonate. Let me read it. So diapers should be changed when soiled or at least every 4 hours to keep the area clean, right? And also it can prevent the infection. Petroleum gauze or ointment should be applied at every diaper change to prevent the sticking. And also the diaper should be secured loosely to minimize the pressure against the healing circumcision site. The question here, the nurse assessment a newborn with the skin discoloration. Sometimes NCLEX board give you a picture, you have to look at it and then decide what is the correct answer. So this skin discoloration at the lumbar areas and also showing in the exhibit means if you go in the bottom, you see this is the picture. So is it normal or abnormal? We are going to focus on it. Here 2 more pictures I left for you for better understanding. Let me explain one by one. What should be appropriate action for the nurse to complete? So if you see the newborn baby have this spot, what we could do, right? So first of all, we have to know what are the normal findings of newborn. Like this is the spot, it is called Mongolian spot. And these are normal findings. And this spot will be disappeared or fade when the baby will be the age 1 or 2 years. So now, what are the options? Number one, assessment the infant hemoglobin, hematocrit, and platelet. So as I told you, it is not abnormal. It is not any bleeding defect. It is normal Mongolian spot which will be disappear without any treatment. So we do not need to check the hemoglobin, hematocrit, or platelet. So measure and document the size and location of the marking. So the newborn baby has a marking, birthmark, even normal findings. We always keep documentation, and good documentation is save you and also save the patient. Easy to convey the data from other healthcare provider. Notify the healthcare provider of the marking immediately. So as you know, this is a normal findings, nothing abnormal, nothing serious. We do not need to inform healthcare provider immediately. So it is not a choice, but keep documentation is good. Number four, question of the parents regarding events occur after delivery of the infant. So anything is happened during the delivery, you can ask, but again I said it is not abnormal. So that question to asking about is very unnecessary. So sometimes we can see this spot we called a congenital dermal melanocytosis or Mongolian spot. It is the benign discoloration of the skin most commonly seen in the newborn of African American descent or Asian descent. The color is typically blue or easily misidentify as a bluish, because the bruise or ecchymosis, it is a bleeding spot because of blood disorder. It is important for the nurse to measure and keep document the area, refer for further healthcare provider. So Mongolian spot are a common birthmark. It is not associated with abnormal findings. Here we left two more picture. This one, it is called strawberry hemangioma. It is also normal. Raised rough area of the skin. It is also normal and will be disappear. Some patient develop the even jaundice at the birth. It is physiological hyperbilirubinemia. It's normal. Sometimes patient develop petechia or Mila, right? Vernix caseosa, white cheesy substance around the body. This picture, you can see the prominent in the skull. You see in this picture I'm showing you. This is called caput succedanum. So caput succedanum or cephalohematoma also normal. It is the edema or edematous area in the head, and it will be disappear as well. If patient develops cephalohematoma, means collecting blood under the periosteum. So because of during the delivery process, we use so many instruments like forceps delivery or vacuum extraction. Sometimes it is occur, but it will be disappear automatically. So what are the education objectives? Congenital dermal melanocytosis or Mongolian spot is a benign discolor of the skin, typically found in the buttock or back. So color is usually bluish gray or maybe misidentified as a bruising, because bruising is a clinical condition. Also, proper documentation is essential to avoid the misinterpretation of the findings. What next? Question here. The nurse is caring for 4 hospitalized clients. Which client should the nurse assist first? There are 4 options, 4 patients. Out of 4 patients, which patient we have to check first? Which is the most danger? Which patient is under the life-threatening? Number 1, the client with a hyperemesis gravidarum who is currently vomiting. So hyperemesis gravidarum patient usually complain excessive nausea and vomiting in early pregnancy. And if you give them IV hydration or antiemetics or monitor for the electrolyte imbalance and correct the dehydration, it will be okay. It is not a life-threatening or emergency medical condition. Number 2, the client with a molar pregnancy who has dark brown vaginal discharge. So molar pregnancy, it is the non-cancerous tumor basically that develop in the uterus as a result of a non-viable pregnancy. So there may or may not be an embryo or placental tissue inside the uterus. If there is any embryo, it unfortunately would not be able to survive because of molar pregnancy. Molar pregnancy also we call hydatidiform mole, right? The patient who have a molar pregnancy, they may seem normal at the first trimester, but when the symptoms develop, they include the dark brown or bright red vaginal bleeding during the first trimester. But we know if pregnancy is okay, everything is under control, patient will be amenorrheic or no menstruation, bleeding, no bleeding. But molar pregnancy, patient complain dark brown to bright red vaginal bleeding during the first trimester, along with the severe nausea and vomiting. But we have to exclude it, but it is not the emergency, as like the patient who is ectopic pregnancy. The client with suspected ectopic pregnancy who has abdominal or shoulder pain. So ectopic pregnancy, it is the complication of pregnancy in which the embryo outside the uterus. So here we see a picture. This is the normal pregnancy. You can see it is a uterus. It is called endometrium, fundus, fallopian tube, ovary, and fimbria. So ovary discharge ova and sperm come this and they united here. And then zygote is transported all over fallopian tube and implanted in the uterus. And this is occur in case of normal pregnancy. But if the zygote or ova and sperm united in the fallopian tube, especially ampulla, when they're traveling, if they fail to travel or if they implanted inside the fallopian tube, or if any zygote is implanted any side except the body of uterus, we called ectopic pregnancy. Ectopic pregnancy is the complication of pregnancy where the embryo outside the uterus, like this picture, uterus in the fallopian tube. Usually, if the patient have ectopic pregnancy, they have a sign and symptom classically included abdominal pain and vaginal bleeding. And usually it is the medical emergency and ectopic pregnancy not survive and it is rupture anytime and causes bleeding and patient undergo the shock and they die if it is untreated. So the client with suspected ectopic pregnancy who is abdominal pain and shoulder pain we call referred pain. So we have to correct it first. We take to the measurement, we take to management because it is the medical emergencies. Number 4, a client with a miscarriage, right? Abortion. And patient saying, I am a Jehovah Witness. Usually Jehovah Witness are not allowed to blood transfusion. In this question, talking the threatened miscarriage, right? The client with a miscarriage who say, so you maybe convince them or you give them some alternative, you give them some saline solution and correct the blood loss. But out of 4 patients, number 3 is most serious. You have to check first. What is their explanation? They said the ectopic pregnancy occur when a fertilized egg implanted and begin to grow outside the uterus, most often the fallopian tube. The fetus cannot survive and it will grow and causes the rupture of fallopian tube if it is untreated. The client with the ectopic pregnancy report sudden onset of abdominal pain and also they complain of shoulder pain and it is called referred pain. It is a classical sign of irritation of the diaphragm and also usually due to intra-abdominal bleeding. Rupture ectopic pregnancy is a surgical emergency due to the blood loss and require priority of hemodynamic support. So when massive blood loss because of rupture, patient blood pressure go down, blood volume go down, and they lead to hypovolemic shock. So hemodynamic support is important. Like you give them IV fluid, you give them blood transfusion, and patient will survive. What next? We called educational objectives. Ectopic pregnancy is a serious condition that results in loss of fetus and cause and can be life-threatening to the mother if not treated quickly. So this is the reason it is the most serious. You have to check the first, life-threatening. Once the fertilized egg begin to grow in the fallopian tube, the risks of rupture fallopian tube. The rupture of the tube will result in the significant blood loss and will require surgical correction and possible transfusion. And Shoulder pain in the client with ectopic pregnancy indicate intra-abdominal bleeding.